amino acid. So these minerals, they are needed for proper function of organ, bone, tissue, as well as immune system. So there are two subclasses of mineral, which are macro minerals and trace mineral. Macro mineral, we need that, quite a lot compared to trace mineral. The name of trace mineral, the name of trace mineral, it's because that we only need in this type of mineral in the trace amount. Okay, you can see here in this table here, in the pink box, which are macro mineral, and in the green box are trace mineral. Some very common and some not very common. We go to macro mineral first. All right, macro mineral. We have 1, 2, 3, 4, 5, 6, 7 main macro minerals that are needed by our body. All of these, which are quite familiar for you, I think. Sodium, of course, chloride, potassium, calcium, phosphorus, magnesium, and sulfur. Sodium, chloride. These two, we take it, quite a lot every day. And mineral in the 60 kilogram of human body, about 132 pound of 60 kilogram human body. So calcium, you can see here, the main mineral that in 60 kilogram of human body is calcium, which is 1,150 gram, 1.1 kilogram of calcium in 60 kilogram body weight. Phosphorus, the next abundant mineral in 60 kilogram body weight is phosphorus with 600 gram, and then potassium, and the least macro mineral is magnesium, which is 30 gram. So, and then the rest here, trace mineral, even less. Iron is the highest, highest amount of trace mineral that can be found in 60 kilogram body weight, which are 2.4 gram only, and selenium is even less, 0.02. So micro mineral are those present in amount larger than 5 gram, about a teaspoon. A pound is about 454 gram. Thus, only calcium and phosphorus appear in amount larger than that. All right. So for trace mineral, there are more than a dozen trace mineral, although only 6 that I show here. This is the most common trace mineral. The amount that we needed by our body is extremely low, but we still need them for our body to function properly. So we go one by one. For the macro mineral, first we start with sodium. Sodium, the function of sodium, normally as a fluid volume regulator. You know what sodium does, right? A systemic electrolyte. Sodium is an electrolyte, and essential in co-regulating ATP with potassium. All right, ATP, ATP channel, you need that co-regulation. When you learn how our body produces ATP, you need that this sodium in, in co-regulating of ATP with potassium. It's not that hard for us to get sodium. We can get lots of sodium from processed food, lots of sodium in cheese, bread, and cereal. Even if you see in this picture here, 50 to 60 potato chips, new recommended daily intake of sodium 1.5 gram total per day, equivalent to 50 to 60 potato chip, 2 large dill pickles, 1 cup canned spaghetti sauce, less than 2 cups of canned soup. All right. Okay. So condition of sodium imbalance. When you have sodium imbalance, we call it hypernatremia, associated with dehydration. Having too much sodium, too little water. The relation between sodium and water. I hope I don't have to explain. This water loss can occur from illness with vomiting or diarrhea, excessive sweating from exercise or fever. Hyponatremia caused by water intoxication. Drinks so much water it dilutes the sodium in blood. It's not only sodium. If you drink too much water, it dilutes almost all the nutrient in your blood. Okay, what are the symptoms? Can cause lethargy to body, confusion, weakness, swelling, seizures, and coma. Can occur with hyper or hyponatremia. Both can cause this symptom. High blood pressure can result from too much salt in diet. You know that when you have high blood pressure, hypertension, you cannot take too much salt in your diet, which can increase risk of heart disease and stroke. It also can cause kidney failure, can cause chronic kidney disease (CKD). A normal blood sodium level 135 to 145 milliequivalent, or in international unit 135 to 145 millimoles or milliosmol. So this is what happens when you take too much or too little sodium. Next, chloride. So function of chloride: maintaining fluids and electrolyte balance. So similar with sodium, it works with other minerals such as sodium and potassium to maintain proper balance of body fluids, as well as maintaining the pH balance. Essential component of digestive juice needed with hydrogen to form stomach HCl. If you don't have enough chloride, you cannot forming digestive juice properly. It can disrupt the pH of the stomach. So mostly comes from processed food as part of sodium chloride. When you take a table salt, it is sodium chloride. Normally you will not have problem for sodium and chloride, because we take this almost every day in almost every food that we eat. So how about the condition of chloride imbalance? You can have excess of chloride. We call it hyperchloremia. When you have excess in chloride, an electrolyte disturbance in which there is an elevated level of the chloride ion in the blood, too much chloride ion in the blood, too much water is being excreted in the urine, therefore less water is available to dilute these areas of high ion concentration. So this can be due to diarrhea, vomiting. When you have diarrhea, less water in your body. When you vomit, renal disease, renal failure that cannot play the proper function of the kidney, and renal tubular acidosis. All right, how about the deficiency of chloride? The deficiency of chloride, we call it hypochloremia, electrolyte disturbance in which there is an absolutely abnormally low level of the chloride ion in the blood. This is rare because, as I just explained, we can get lots of chloride and sodium in our diet. So, but as chloride is part of table salt, which is present in most foods, the deficiency is very rare. So the normal serum range for chloride is between 97 to 107 milliequivalent per liter. All right, what else? The next macro mineral that can be found abundant in our body is potassium. Is sodium, chloride, and potassium. We don't have problem to get these macro mineral in our body because we can get it a lot in our diet. The function of potassium: maintaining fluid and electrolyte balance, homeostasis of membrane potential. So if you go back to the membrane, when you later on in your lipid metabolism classes, you will learn about the membrane potential, which potassium can play a role in maintaining the homeostasis of this membrane potential. One of the most important things about the membrane potential is for maintaining the steady heartbeat. The source of potassium found in both plant and animals, less found in processed food. This foods here contain lots of potassium, especially banana. That's why if you don't know where to get potassium from, you just eat banana and you will be fine. Banana contains lots of potassium. So condition for potassium imbalance or excess in potassium and electrolyte disturbance in which there is an elevated level of potassium in blood above 5.5 milliequivalent per liter. The most common cause kidney failure. Since the kidney excreted potassium from the body, any impairment in normal kidney function can cause potassium level to rise. Okay. But you may experience nausea, slow, weak, irregular pulse, or fainting. So this is, one of the marker when people have kidney disease. Early on the symptom, you can have the trace amount of potassium in your urine. You can have trace amount of potassium in your urine. You can have elevated level of protein in your urine. This can identify the kidney disease. So how about the deficiency of potassium? We call it hypokalemia, electrolytes disturbance in which there is an abnormal level of potassium in the blood. When you have low level of potassium in your blood, because you know that potassium maintaining the steady heartbeat, it can cause a heart palpitation or rapid pulse. It can cause muscle weakness. It can cause a sweating while exercise, can deplete your electrolytes, so it can cause dehydration. When you have dehydration, the level of potassium will be decreasing. Also, diarrhea, vomiting, certain medication also can cause deficiency in potassium in your blood. So when you have low level of potassium, normally, that's why when, for athletes, for people who always exercise regularly, they need to have electrolyte drinks in order to to cover the dehydration that can be caused during sweating while exercising. Okay, the effect of processing on sodium and potassium content in food. You can see here, when the milk is unprocessed, unprocessed milk, it is high in potassium and low in sodium. When you process the milk into products such as jello or pudding, it's the other way around, where you can have high amount of sodium and low amount of potassium, because to make sure to maintain the food, you need to have high amount of sodium, because high amount of sodium will prevent the growth of the microorganism in the food product. So for meat, for roast beef, the unprocessed roast beef contain very high amount of potassium, but when you do beef, cheap beef or beef jerky, you add lots of sodium in order to maintain it, to extend the shelf life of the product. It will have lots of sodium while low potassium. Same goes to other type of fruits. For example, fruits such as corn, fresh corn, very high, 90% potassium and 10% sodium. When you process corn into canned product corn, we will need to add high amount of sodium. Fresh peaches, almost all is from potassium. Very little to no sodium in fresh fruits. And when you make pie, you increase the sodium concentration. Also same with rolled oat or grain or wheat. When you make oat cereal, actually it contains a high amount of sodium. It is good for your body in terms of it contains undigestible dietary fiber, which is very good for your body, very good for your gut bacteria. But anything that you eat, you should take it in consideration, because the amount of sodium for processed food is very high. Same goes to to other processed foods such as burger, nugget contains high amount of sodium. Okay, I think because for calcium we need to explain about the role of calcium here. I think we don't enough time. I think